Welcome to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati, who would like to discuss the risks associated with surgical site infection.
Well, spine surgery is a very common surgery. The problem is there are different types of procedures or different types of techniques that some of those ones create different types of complications or problems. Infections in procedures like the one that we do at the Institute that we use an arthroscope to treat the patients with it, this procedure carry a possible level of infection of 0.5. The infections on the spine after surgery can be two types. One is a superficial type of infection, and the other one is a deep type of infection. The superficial infections are not very bad to treat. If you are immediately alert to some type of a problem on the wound, and the patient show you the wound is in a certain way, looks a little bit abnormal, then cleaning that wound and treating that wound is the must be done. If you do that, you are going to avoid that this infection can trickle down and create a deep infection. A deep infection is extremely dangerous because not only is go directly to the canal that you already opened, it's a free communication from the skin that is contaminated to the areas that you operate. And that is practically associated with a structure like muscle, fascia, fatty tissue. All these elements are areas that the infection can grow very easy. Sometimes the infection can get on the bones, and then you develop osteomyelitis. That is an incredible bad type of a problem that takes a long time to treat. Other times, if the deep infection may go to the disc and create discitis. The discitis is an inflammatory process that happens on the disc. And sometimes this discitis is so incredible aggressive, depending on the microorganism that is responsible for the infection. If it is a staphylococcus, it's incredible aggressive. Usually will destroy the bone. So not only the disc will be affected, but now will be also destruction of bone present. And you can see that one in the MRI, you can see that one in the X-ray. The way that you need to understand these infections is practically a very clear understanding of the patient health before you touch the patient. If the patient is a diabetic, you need to be careful and you need to prevent any type of exposure. You need to see what illnesses is affecting the area. For example, patients that they are in anticoagulants, then you do the surgery and you have a massive bleeding in that area. And if you have a massive bleeding, that clot needs to be treated as soon as possible, because not only is going to create pain, can compromise also the neurological structure, but the important thing is that it can be a seeding step for any microorganism. So you have a massive abscess. Those things, they need to be considered, you need to look at, and you need to be very conscientious how you treat the superficial infection, how you treat the deep infection. And the deep infection usually is associated with some type of exposure of microorganisms that they are on the skin. Usually the people have the surgery and they lie down in bed, they have pain, they sleep on the wound. If the wound is not properly clean and is not observed all the time, that infection can immediately affect the area, and then you can have a situation that can be superficial initially, deep later. You need to remember that the possibilities of infection with this procedure that we have at the Institute are not only minimal, almost non-existent. And they are because while we are doing the surgery through the whole procedure, after we introduce a tube and put the instruments to work, we need to clean the scope. And cleaning the scope means that the lens, they need to be totally clean so you can see what are you doing on the inside. To do that, you need to have fluid. So we use normal saline and then with antibiotics. So the area is totally surrounded and treated with antibiotics through the whole time of the procedure. So the possibilities of bugs growing in that area are practically none.
So the risk assessment for surgical site infection is highly reduced due to the constant irrigation of antibiotics in the surgical site area with your patented Bonati spine procedures. Well, that's all the time we have for this segment. Make sure you stay tuned. We'll be back after the break. You are watching American Medicine Today.